Alexander Scott is the director of the Department of Health, who is celebrating the work of the Newport Heads with us here today. And I want to tell you that as director, she has really made the achievement of optimal health for every community throughout Rhode Island the principal focus of the Department of Health. And we are very glad she has. Dr. Alexander Scott.
Thank you, Barbara, for that introduction. Thank you to Citizens Bank for your generous contribution. I am so excited that this is what it's really all about. You know, really being able to build momentum, start with the community, where the needs are, and to add to that so that the health equity can be achieved, and it can be regardless of zip code or other determinants. So Citizens Bank, it's truly appreciated what you've done here in contributing. It's going to be instrumental in helping the Wellness Hub here at the Florence Gray Center get off the ground and become an integral part of this community. When you really think of the difference that it's going to make and the lives that are going to be impacted, it's truly an exciting endeavor that makes it so worth it to drive all the way from Providence to Newport just to be here to talk and to celebrate. I also want to give thanks to Lori DiPerzio for her leadership, to Stephanie Bannister, to Jessica Walsh, to Olivia Cushingway, and the entire Women's Resource Center team for hosting this wonderful event, for being leaders and being true promoters of health equity so that we can make the differences that need to be made. Finally, I want to acknowledge Barry Freeman from Bike Newport, as well as acknowledge Councilman Camacho and everyone else who has come out to lend their support. I also want to give appreciation and acknowledgement to our legislators who work so hard to help make sure that Newport is supported and we get to address health equity the way we want to. So Representative Lauren Carson, Representative Abney, who are such advocates for Newport and helping them make the changes that are needed, and certainly Senator Paiva-Weed, Senator Whitehouse, and Senator Reed, who are all champions in promoting health equity along with us. So we're great partners, and it's certainly appreciated. So with such excitement being here today to recognize the tremendous progress made by the Newport Health Equity Zone, I'm thrilled to participate in the ribbon cutting at the first of 2 new fantastic wellness hubs. What an awesome concept, just having the collaborative come together to determine that this is what's beneficial for the Newport community to really make a difference is truly inspiring. So congratulations to everyone who helped make this happen. I'm also looking forward to joining you for the ribbon cutting at the Wellness Hub at the Dr. Martin Luther King Jr. Community Center soon as well. The momentum building that you can feel with the community driving it and making sure that health equity is achieved overall, involving social and environmental determinants of health, is just thrilling. So it's not just because I love spending time down here in beautiful Newport on a summer afternoon, but what's thrilling is this idea of a wellness hub that is truly brilliant and is really what the entire Health Equity Zones initiative is all about. Our vision in developing the Health Equity Zones was to empower communities with resources so that they could identify the health issues that residents in their communities are facing and make collaborative decisions using the assets already present and existing in the community, along with new partners that want to join and contribute to that, to address the health issues and other concerns of residents within those communities. That's really the essence of the Health Equity Zones. And to put those decisions into motion with the talent, passion, and commitment that already exists in those neighborhoods. So to see that type of momentum building here today definitely makes it worthwhile. One example of how the momentum building is playing out in Newport is your decision here to have the lifestyle change programs at the Wellness Hub be facilitated by residents who live within walking distance of the center. That's fantastic. It allows for building sustainable partnerships and collaboratives that you know will live on for generation after generation in the Newport community. It's a perfect demonstration of the concept of building a healthy community for the long term. Throughout Rhode Island, we have 10 different health equity zone projects underway aimed at doing a lot of what's being done here. Preventing chronic diseases, improving birth outcomes, and improving and addressing the social and environmental conditions of communities that we know really makes a difference in determining our health outcomes. Of course, there are some differences in the work being done in each health equity zone, but the common thread throughout each of these projects is the belief that a person's health should not be determined by his or her zip code. In this same way, a person's health should also not be determined by their race, by their ethnicity, by their level of education, by their level of income, by their gender, sexual orientation, or gender orientation. The great work that you're doing here in Newport and all the things that will be happening at the 2 wellness hubs is helping to build a Rhode Island where it's not the case that zip code or other determinants impact your health outcomes. We want to make it so that wherever someone lives in Rhode Island, you have the opportunity to live the healthiest life you can live in the healthiest community that you can live in. By doing things like promoting and supporting diabetes prevention and self-management programs, also doing things like building social behavioral capacities into community-based early childhood systems of care, or by putting in place an innovative plan to develop shared use agreements so that we could expand opportunities for physical activity for adults and for children, you are helping to build a more just, equitable, and healthy Rhode Island across the board, regardless of zip code. Those are just a few examples of the strategies that are part of your plans. I could go on because of how exciting it is to see everything come together and the support that's here, but I know you have a full agenda. So before passing the mic, I want to thank you all one more time for the wonderful example that you're setting. Thank you to citizens for your acknowledgement, your contribution to this momentum building, to Channel 10 as well, making this public, making it worldwide, as you had mentioned, so that we could spread the word. Health equity, building healthy communities. That's how we're going to make a difference with health outcomes, and Rhode Island is going to be a leader in doing that. I want to congratulate you all on the hard work, the leadership that you've set in launching this new wellness hub. Keep up the great work. I look forward to continuing to partner with you on behalf of the Department of Health and all of the partners who are in full support as we engage and make a difference in the months and years to come. So thank you, everyone.